Hi, today I'm going to talk about prions in the urine of patients with Variant Creutzfelt Jakob Disease. But first, what are the prions? It is the infection agents responsible for transmissible spongiform encephalopathies. Consists mainly of the misfolded prion protein. Prion diseases are fatal neurodegenerative disorder for which no therapy or definitive non-invasive intravital diagnosis is available.
Prions. Prions cause numerous diseases in mammals, including scrapie in sheep, bovine spongiform encephalopathy in cows, commonly known as mad cow disease, and Creutzfeldt Jakob disease in humans. This is a representation of a normal PRP protein in the body. When this protein is misfolded, an abnormally shaped prion is formed instead. A prion propagates by changing other normal proteins into the prion form. When enough of these prion proteins accumulate, they are called aggregates of prions. Eventually, these aggregates cause neurodegenerative symptoms in the host. In all cases, varying degrees of spongiform degeneration can be observed in the central nervous system. Unfortunately, no cure for prion disease has been discovered yet. One of the major difficulties is that prions are virtually indestructible, as opposed to normal proteins. Hopefully, with a little more research, scientists will soon find a solution.
Creutzfeldt Jakob disease in human and scrapie bovine spongiform encephalopathy and chronic wasting disease in animals are the most common forms of transmissible spongiform encephalopathies. One moment, please. Sorry. So let's see another video about the Creutzfeldt Jakobs.
Where Conan Doyle got the role model for his famous fictional detective Sherlock Holmes. Okay, so that's the past. Now let's fast forward, straight forward to today. We don't have forensic surgeons anymore, but we certainly have pathologists. And one of the world's most famous pathologists is going to talk to us today. James Ironside is Professor of Neuropathology and has had a stellar career in his subject. He's been consultant histopathologist both in Lothian and in Tayside, but is most famous for heading the neuropathology labs in the National Creutzfelt Jakob Disease Surveillance Unit, which has been based here in Edinburgh. He has made some very seminal discoveries indeed. Most famously, of course, the discovery of something which got very much into the press and which he'll tell us about today, which is the variant of Creutzfeldt Jakob disease that came potentially from our consumption of cows infected with mad cow disease. And that's, I hope, what he's going to explain to us today. James is a phenomenal role model for his subject. Pathology was always thought of as dry, but the ability to be a detective in that subject, to really get to the heart of disease, to spot the new diseases as they come up, is of course incredibly exciting, and it's what attracts the best and the brightest to the subject. James is no exception. He got a CBE in the Queen's Honours a few years ago for his contribution to medical science, and I hope we will enjoy his lecture this evening. James, the floor's yours.
So, the unique mechanism of transmission and the appearance of a variant form of Creutzfeldt Jakob disease, which has been linked to consumption of prion contaminated cattle meat, have raised concerns about public health. Evidence suggests that variant Creutzfeldt Jakob disease prions circulate in body fluids from people in whom the disease is silent incubating. Let's see a case of
This is a book all our scrapbooking friends.
Then the warm memories of his 17 years with wife Michelle well up just as quickly as the tears of loss.
She'd always smile. Her laugh. Her laugh was great. She was great. Really? Can I say?
In March of 2011, 42-year-old Michelle experienced a sudden onset of stroke-like symptoms, difficulty speaking, confusion, and odd movements. All tests came back negative, and she was sent home. But Michelle was still struggling.
You know, everything was not working. She'd put her shirts on backward.
Within a few days, Michelle was back in the hospital to stay. Stroke and meningitis were ruled out. Kip says primary care doctors and specialists were stumped. And then, without the chance to ever say goodbye, his wife was gone.
40 days, I think, from the beginning to the end, it was done.
The diagnosis, Creutzfelt Jakob Disease, CJD. There is no treatment, and it is always fatal.
We call rapidly dementing illness. That's something that affects cognitive skills, memory, thinking, behavior, and it comes on rapidly.
Mayo Clinic neurologist Dr. Alan Axenet says an abnormal infectious protein called a prion is believed to be the cause of CJD, actually creating holes in and around neurons in the brain.
It co-opts the normal protein, and then it becomes a self-replicating or self-amplifying process, which essentially kills neurons and gets transmitted to other neurons in the vicinity.
Dr. Axemet says 90% of cases are sporadic, striking spontaneously without a known cause. The other 10% are familial, which was Michelle's case. Kip says that means their sons Cody and Devin have a 50-50 chance of developing CJD, a possibility he finds very hard to bear.
The normal person, if you knew you had it, you couldn't get married, you couldn't have kids, you know.
Since CJD affects just 1 in a million people, research is slow to progress, yet that is Kip's only hope of erasing the long shadow cast by a dreaded disease. For Mayo Clinic News Network, I'm Dennis Doda.
To investigate whether prions can be detected in the urine of patients with Variant Creutzfelt Jakob Disease, we use the protein misfolding cyclid amplification. It's a technique to amplify minute quantities of prion, enabling highly sensitive detection of the protein. So prions was detectable only in the urine of patients with Variant Creutzfelt Jakob disease and had the typical electrophoretic profile associated with this disease. Let's see another video.
Today is Saturday, August 11, 2012. My name is Victoria Godfrey, and I am reporting to you from the United Kingdom about Variant Creutzfelt Disease, commonly known as mad cow disease. Back in 2004, scientists took a survey to see how many carriers there were of the Variant Creutzfelt Disease. Today, the number they estimated has doubled and is becoming an increased problem in humans. Today, we have identified 24,000 carriers of the disease throughout the United Kingdom. It takes many years for there to be evident signs that you have this disease. Due to the diet of cattle years ago, many elder people today have reached the point in their lives where they notice the effects of the disease and are suffering from the severe consequences of it. They first discovered this disease in March of 1996. Humans are infected with this disease through the consumption of beef. The disease comes from cattle that are infected with BSE, which is bovine spongiform encephalopathy. The cows get this because they have been fed ground-up animal carcasses. Many people carry the agent that causes the disease, but not all of them get the full disease. In 1996, only 173 of the 24,000 people from the United Kingdom were diagnosed with Variant Creutzfelt disease. We have attempted to stop the spread of this disease by prohibiting cattle from consuming ground-up carcasses of other cattle and animals. We are also careful to not use the same tools on different people so that the disease cannot accidentally be spread through the blood. The good thing is that the disease is not contagious. However, Variant Creutzfelt disease destroys brain cells and it eventually leads to death. Early symptoms of the disease are mood swings, depression, anxiety, and insomnia. Once disease becomes more serious, the person suffers from dementia, blindness, muscle paralysis, and slurred speech. Sadly, there is no cure to the disease. The best way
Some studies show that prions can be detected in the urine of patients with Variant Creutzfelt Jakob disease with high sensitivity and specificity. Thank you. I hope you will learn about this disease, the Creutzfelt Jakob variants. Bye.